Dr. Zinn, and today we are talking about the risk factors for colorectal cancer. It's good timing because March is National Colorectal Cancer Awareness Month, and Dr. Scott Ackerman is one of the First Coast leading oncologists. He is here today to talk about who is at risk and when you should start thinking about getting screened. Welcome, Dr. Ackerman. We appreciate you being here, and this is something that's obviously in the news a lot now because of the timing of everything, with this being Awareness Month. But let's start off with what puts somebody at higher risk for getting colorectal cancer. What can we avoid in our lives if we can't avoid any of these things?
Oh, there's lots that we can avoid. Some things we can't avoid, but there are lots that we can. First of all, colorectal cancer. That's cancer of the colon and cancer of the rectum. We kind of put that together as colorectal cancer because the risk factors and the treatment are very similar for tumors of the colon and tumors of the rectum. And the type of cancer are similar for both those areas. Most of them, 90% of them, are diagnosed in people over the age of 50. So age is a risk factor. That's something you can't avoid, hopefully. You can't avoid getting older. And so if you're over the age of 50, you're at higher risk for colorectal cancer than those younger. And in my practice, I do see patients under the age of 50 with colorectal cancer, but it's rather infrequent. Usually they're over the age of 50. If someone has a personal history of polyps, meaning they have polyps in the colon, or a history of inflammatory bowel disease, such as ulcerative colitis or Crohn's disease, that puts them at a higher risk for colon cancer. Also, if there's a family history of colon cancer, meaning if they have a parent or a grandparent with colon cancer, that puts them at higher risk. Certain ethnic groups and nationalities, people of African American descent or Ashkenazi Jews, have a higher risk of colorectal cancer. Certain lifestyles put you at higher risk, such as a poor diet. So I generally recommend to patients that they eat a diet high in fiber, less processed meats, to diminish the risk of colorectal cancer. But also other lifestyle things, such as physical inactivity, obesity, drinking quite a bit. Those all would put one at higher risk for colorectal cancer. And finally, there's certain genetic defects that would put you at higher risk.
Okay, so let's talk about that genetic predisposition to get colorectal cancer. How do you know if you have that? Do you just have to go back and look at your history? Is there a test or something that you can do to try to determine if you're at higher risk?
Well, as I mentioned before, I said that if you have a family history,
sure,
you're at higher risk. So there's some genetic defects that just come with having a family history, or certain genes that are associated with it. Genetic defects in general, these are inherited mutations of the genes, and they sometimes can increase the likelihood of developing cancer. These genetic mutations can do all sorts of different diseases, but in certain cancers we've identified some genetic mutations that are associated with having a higher risk of cancer. For instance, we spoke about on this show before the BRCA test for breast cancer.
Right.
So we know that the BRCA, the BRCA test, is associated with a higher risk of breast cancer. For colorectal cancer, we've identified a number of genes that together, or I'm sorry, individually, any one of these genes would put you at a higher risk. And collectively, these genes are associated with something called Lynch syndrome. So we don't really define it by BRCA, by the specific gene, because the whole family of genes, and it's called Lynch syndrome. And Lynch syndrome is associated with a number of genetic defects in certain families, and these account for about 3 to 5% of colon cancers. So if you have a family history of colon cancer, or if you have colon cancer, you speak with your doctor. It's a simple blood test that can be done, just like the BRCA test for breast cancer, a simple blood test that can be done to see if you have Lynch syndrome, which means you have a familial or a family disposition to getting colon cancer.
So, and that doesn't necessarily mean that you will get it, you just have a higher likelihood that you could?
Lynch syndrome patients have a significantly higher likelihood. Where if you just have a family history of colon cancer, you have a higher likelihood, but Lynch syndrome patients have about a 40 or 50% chance of developing colon cancer sometime in their life.
Okay, what about screenings? When should you, I mean, because we always talk about the importance, you know, with breast cancer, we talked about getting your mammograms by a certain age. What about screenings for this? When should you start? What do you do?
Well, screenings for colon cancer is unique in that colon cancer is the only cancer that our screenings not just find cancers early, but prevent cancers. And with mammograms, we can't prevent breast cancer, but we can find it early. But with colon cancer, screenings not only identify it early, but can actually have the potential to prevent colon cancer. Let me explain why. First of all, let me talk about when we should do screenings. The screenings that I recommend after the age of 50, and the screening should be done every 5 to 10 years depending on the kind of screening. If you're at high risk, meaning you have family history of colon cancer, if you have Lynch syndrome, or if you have ulcerative colitis, those sort of things, I recommend you start screening at age 40 and talk to your physician about how frequently to get screened.
Okay.
Now let me talk to you about the type of screening options that there are.
Sure.
There's 3 options. There's a sigmoidoscopy, a barium enema, and a CT colonoscopy that are fairly simple to do, but because they're simple to do and they're not as complete, we recommend that you do them every 3 to 5 years. But the colonoscopy, where it's a complete evaluation of the colon.
That seems like the most common. Doesn't it seem when you hear about it, that's the one that people bring up more often than not?
Right, and that's because that's the gold standard.
Okay.
A colonoscopy, you take medication that cleans out your colon the night before, and then the endoscopist goes in and he or she looks and evaluates the entire colon, looks at every inch of the colon to look for any problems, look for any polyps or anything else that might be in there, look for any tumors. And before, when I mentioned that screenings can actually not just detect colon cancer early, but can diminish your risk of colon cancer, this is because the colonoscopy can identify adenomas and polyps that are not malignant, but if they're left unchecked, can become cancers. So when the colonoscopist is in there looking, he or she can snare these, cut these out, using the endoscope, and prevent colon cancer from developing.
Yeah,
so
which is incredible.
Right. So my recommendation is to get a colonoscopy once every 10 years, beginning at age 50, if you're at normal risk, or at beginning at age 40 if you're at high risk. And depending on what the colonoscopist finds, if it's a normal exam, you can have it done every 10 years. But if he or she finds something, you may need to get it done more often.
All right, Dr. Ackerman, thanks so much for being here. We appreciate that. And Dr. Ackerman joins us every Friday, and next week he will be discussing the PCA3 test for prostate cancer. So for questions regarding today's topic or any other health questions that you might have, just visit firstcoastoncology.com and confidentially submit your questions to Ask the Doctor.